Welcome to Her Body and Mind podcast. Today is part 3 of our 3-part series on iron.
Yeah.
So today we will be discussing general causes for iron deficiency, female specific causes for iron deficiency, and then we'll get a little bit into treatment. I am Dr. Sierra Fox.
I'm Amanda Sarich.
And this is our podcast.
Welcome here. Okay, so we've learned together so much about iron in the last few episodes.
Sure have.
Yep. So today, let's just start with what are the major causes of low iron in the general population, Dr. Fox?
Sounds good. Yeah. So these causes are for everyone. So male and female causes. So why don't we start off with dietary considerations? So this is a big one, I would say. And although it will just kind of dive right into vegan, vegetarian diet, although it's a very common diet, I'm always surprised when I have a vegan or a vegetarian come into my office and it's lost on them that this is a significant deficiency.
Right. Yeah.
I think because there's so many good, beautiful health benefits to it, it's really hard to intake the idea that there could be a con. You know what I mean? Yeah. It's an interesting kind of concept, but I do find that this population, though the information is out there, they don't realize the significance of it, given that animal sources of iron versus a plant-based source, for example, spinach versus beef, for example, they're very different sources of iron. So animal meat is a heme source. So heme is animal, and we absorb that to the tune of probably 15 to 35%. So if we'd taken a bite of beef, we would get about 15 to 35% of that iron from that meat. Okay. Versus if you were to have some spinach, it would be 2 to 20% of that iron you'd absorb.
Yeah.
And then from a volume perspective, there's just a higher concentration of iron in general in the meat versus in a plant-based source like a bean or spinach or what have you. Does that make sense?
It does make sense. I think people like to think kind of in black and white terms. So it's this is all good or all bad, but all good things can have bad parts.
Yeah. So if you're reading labels, as we often do, because a lot of the nutritional facts are listed, what we don't realize is that though it might say, oh, it has 15% of your daily intake of iron, that doesn't mean you're absorbing 15%.
Which we learned a lot about last episode, which I had no idea.
Yeah.
I had a lot of shock moments.
Yeah, totally. So some other dietary causes for low iron would be just eating a calorie restrictive diet, which is quite popular these days. So whether that's just skipping breakfast and having lunch and dinner, or I know of some people or some patients who they just eat at dinner time. That's it. So it's one large meal per day. But when we're getting into calorie restrictive diets, it is extremely difficult to meet your daily needs of not just iron, but a lot of other micronutrients.
Yeah.
So we focus a lot on macros like protein, carbs, fat, but no one talks about micro, which is your vitamins like this.
It sounds like another good episode.
Yeah, so that would be another reason. And then from a dietary perspective would be kids, picky eaters, or even there's a lot of adults that are picky eaters.
I know about picky eater children.
Right. So just getting a variety of foods in that one likes sometimes can be picky, and kids often I find parents bring up that their kids, it's hard getting their kids to eat protein. So iron sources of food for some reason, that's their kids kind of, whether it's a textural thing, a taste thing, they just don't love it. So they're eating more of a carb-based diet.
Yeah. Kids like gray and brown.
Yeah. Right.
Right?
So that can be really tricky too. And as an aside, I can't remember if I have this weaved in here as well, but giving a little ode to ADHD and ADHD medication. If your kid is on a stimulant, which is an appetite suppressant, that too, going into calorie restrictive diets or time restrictive, it's because of the loss of appetite. So they're just not eating enough calorically a day to then meet the needs for any macro or micronutrient.
Oh, that's a really good point.
Yeah. So those are some more of the general dietary reasons. Now we also then have growth. So there's 2 kind of phases of life that we grow in. One is female specific and one is not. So you're like, what is it? Can you think?
Have I
confused.
reached my full growth potential?
Well, you've had phases where you've grown more than other phases.
But I'm done now.
I hope so. For both of our sakes. Okay. I'm talking about pregnancy being one of them.
Oh, yes, we need to be done.
Yeah,
I'm done. I'm done.
Oh, she is. I love her children.
But we're done. Okay, tell us about that.
Well, in pregnancy, obviously, it's like you're growing another human. So anything that you intake, you're shunting over to the baby, and that's why so many women do become iron deficient. It's a huge thing in this population. I think this stat is 65% of women who are pregnant by the end will be iron deficient. So that's a large percentage, right? And then you go on to a phase where if you're able to or have the desire to breastfeed, that just compounds. It just gets worse because you actually give out more calories in breastfeeding than you do building the baby. So stay on your prenatal and make sure that you're getting a lot of iron-rich foods.
Give everything to
test your ferritin. Yeah. So that's one. And then just general growth. So kids, peds. So peds, you watch your kids like have these crazy growth spurts. And this is, I mean, a lot of us don't clock this, but when you're building more tissue, it requires more of everything. And so it's, again, as far as like deficiencies in kids go, I don't think that I've ever tested a kid who's been optimal in iron or B12 because of this. Like often if there is like a reason to assess, which is behavioral, energy, moods, whatever, this comes along with it. So it's very, very common.
Makes sense.
Yeah,
totally. It's like they're grumpy when they're growing, but they're also maybe low in iron.
Yeah, possibly double whammy, right? Yeah. So those are the two growth phases. And then we would move into, which is the last part of just general reasons why, would be digestive. And this is like a huge topic within itself with digestion, absorption in general. But if we're just like using iron as like the deficiency, there's a lot of different digestive issues that can arise that can lead to iron deficiency. So the first kind of grouping that I wrote down was autoimmune digestive issues. So this would be things like celiac disease, ulcerative colitis, and Crohn's. You're kind of familiar with all of those ish? Ish. So if you have an autoimmune digestive issue where there's your own immune system attacking the lining of your intestinal lining, whether it's in the colon or the small intestines, depending on where that autoimmune issue is and whether or not that's the area in the digestive tract where a particular nutrient is absorbed, you're going to run into issues, right? Because there's inflammation, irritation, there's leaky gut because of it. And so you're not going to be breaking down your food and you're not going to be absorbing it as well. So when we're screening for celiac disease, for example, we are always screening your ferritin levels because they like always go together. If you have untreated celiac, without a doubt, you will have low iron.
We talked about this a bit when we talked about men having low iron last episode, right?
Yes, that's right. So that's kind of falling into that arena for sure. Then we have things like peptic ulcer disease, so PUD. So that's where you actually get gastritis or even ulcers in the stomach lining. And that the kind of few major causes for that would be actually an organism called H. pylori. So it actually burrows in your stomach lining. And then up front, it can cause high stomach acid and then low stomach acid, but it can create actual ulcers and sores, which can cause just like a slow leak. So bleeding, right? So you're losing iron that way. And then what a lot of people don't know is that just being chronically stressed, it can lead to ulcers, which I personally actually experienced in med school. So all of a sudden I started developing like just nausea and like pressure just in this epigastric area here. And I'm like, what is happening? And I had PUD.
I didn't know you had PUD.
I did when I was at Boucher.
You kept a secret from me.
I guess I was too busy to spread the word.
Didn't know.
But I did. I had to go on actually a medication that is not meant for long-term use, but it was for 2 weeks. I went on a proton pump inhibitor to shut down my own stomach acid, did some like gastric lining healing. I got tested for H. pylori, which was negative, and that's how we knew it was just from stress. So it healed, but it was not fun.
Yeah. Doesn't sound fun.
No, not at all. So that's that section. And then I did mention something about low stomach acid, and that just kind of leads into stress. So when your body is in a stress state, You don't produce stomach acid, which is kind of the first point in breaking down your proteins.
Okay.
So stomach acid is where, let's say you throw some beef down the hatch, you need stomach acid, HCl, to break down that tertiary structure of protein. If that HCl is not there, that step is skipped, and then the beef then goes into the small intestines, but the pancreatic enzymes that can also assist with protein breakdown, it's just not enough. So you're not going to get your Bs, your zinc, your B, or your ferritin, iron. So there's a lot of different things that you won't get because you don't have that first kind of breakdown process happening.
Oh, there's so many pieces, eh?
I know. There's a lot.
Pieces to the puzzle.
Everything's connected. Yes. And then less kind of more, I would say, benign, but still can cause problems. I think that probably most of you at some point in your life have been told you have IBS. I feel like everybody's been told this. Have you ever?
Yeah.
Okay. Who told you had IBS?
A doctor. When was that? That was probably when I was in Alberta doing my undergraduate degree.
Okay.
And my husband was in the military and gone all the time, and I had no friends, and I was in a weird province that I didn't know. And I was having stomach issues. So
lots of stress.
Yeah.
So wasn't secreting HCl or pancreatic enzymes, bile. And then the doctor said it's just IBS. Yeah. What was your prescription for that?
I don't think anything.
Right. They just said you had IBS.
Good luck out there.
Yeah, that's what happens. Exactly. You're like, well, it's not anything big, bad, scary, like an autoimmune gut issue. So it's IBS. It's okay.
Yeah. And now I'm fine.
You're just going to have to deal with it. So that's usually what happens. They say, okay, you have IBS, and just kind of carry on with your life. And it just is what it is. But although like IBS is actually a diagnosis, like it is a diagnosis, but it's not. So it's a symptom. So anything that says syndrome at the end, irritable bowel syndrome. Syndromes are a collection of symptoms that all add up to something, but we don't really know what it is. So we just call it that.
Yeah.
So when someone comes to a naturopathic doctor, we kind of know better. We're like, well, there are causes for IBS. So what's the root cause of the root cause? So we're looking at things like SIBO, which is small intestinal bacterial overgrowth. There could be a yeast overgrowth happening. There could be a parasite. There could be just general food sensitivities. There could be a histaminic issue going on in the gut. So that's just to name a few like causes of IBS, or even just your biome. So if you've had to take a lot of antibiotics in your life, you're wiping out all this good bacteria that is integral to maintain the health of your digestive tract. So a lot of different like areas we have to assess in history to figure out like, where is this coming from? But it's treatable. So this is something that we can actually do something about.
Which is wonderful.
Yeah.
A whole other episode on that too, I think.
Yeah, 100%. And then I'll just kind of list the last other kind of general things and not get into too much detail, but gastrointestinal cancer, unfortunately, kidney disease, because the kidneys produce something called erythropoietin, which is the hormone that tells your bone marrow to produce red blood cells. So if you can't have that, then you're not going to have red blood cells to support or transport heme and iron around the body. So that will be something. Athletes, I find, whether that's in adolescents, teens, or adults, you'll just burn through more nutrients and micro deficiencies. So they tend to be lower. And then there's genetic causes that determine like your ability to absorb iron. So that's another piece as well.
Those make sense.
Yeah. So that's kind of a wrap on just general population reasons for low iron.
Okay. So talk to me about the ladies.
Yeah. So
the women specific.
Yeah. So this is like where most of my practice lies when we're talking about iron deficiency. So the most obvious thing, which we talked about last episode, would be heavy periods.
Yeah.
Obviously, we talked about Amanda's personal experience with heavy periods. One day she's going to treat that.
One day. I shared some specific details at Sierra.
Yeah. So heavy periods is one thing. And then as far as like why a female might have heavy periods, we'll just kind of brush over, would be having underlying endometriosis, something called adenomyosis, uterine fibroids, polycystic ovarian syndrome, or PCOS. And again, that's another syndrome. Hypothyroid or even hyperthyroid. So these are all things that can cause a female to have heavier periods. There are other things, but these are kind of the major kind of conditions, so to speak. So that's that.
Got some of those.
Yeah. And then just general ovarian dysfunction, which kind of some of the heavy period pieces fall in with this, but polycystic ovarian syndrome, perimenopause would be a big one. So given our age and our stage personally that we're in, and again, the population that I treat, I think that a lot of women don't realize their periods are getting heavier because it's kind of like this slow burn. It gradually changes over time. And then suddenly they're changing their tampon an extra 2 times per day, which doesn't seem like a lot, but then that's an extra 20 mils of blood loss per day. And it just kind of all adds up. So this is something that can go unnoticed until maybe you check your iron. You're like, oh, maybe they're heavier than what I thought. So those, I would say, are big reasons. Stress. So stress can cause, it's kind of an indirect thing, but stress can play a role in shifting your hormones, driving more inflammatory responses, which then lead into heavy periods.
But Dr. Fox, are women stressed?
No, never.
No, we have no demands on us?
No.
Oh, so that doesn't make sense for this population.
No. Yeah, everyone's stressed. I would say no, 95% of people, when I ask, because I always have to ask, especially in an intake, it's like, on a scale of 1 to 10, 10 being the most stressed you've ever been, what would you say? And everyone's always in the upper end, right?
Yes.
Like 8, 9, 10. And if they say 6, and then I take more of their history, I'm like, so like you're like an 8 then or a 9? Like they're just so used to it. I think we've talked about this before.
And if in this stage of life, like women, little kids, sometimes helping aging parents, stress, work, like it's a lot.
Yeah, there's a lot on us in general. Not to say that the men don't have.
No, the men have stress.
The men have stress, but different for females. Yeah. The next would be, so if we're just talking about females, again, inflammatory things specific to females. So there can be uterine infections, unfortunately, that are caused by things like sexually transmitted diseases. So this is something that we don't really talk about or think about, but if you or your partner haven't been tested for this and there's any suspicion that there might be an infection that can be driving inflammation, a simple vaginal swab can take care of that to see, like, is there gonorrhea? Is there chlamydia?
Yeah.
These things are serious, and they also cause a bigger issue than just like a heavy period. There can be scar tissue and other things that can develop. So,
and that is everywhere. So get tested.
Yeah, totally. And then like I noted inflammation. So just any sort of systemic inflammation rooted from anywhere in your body will cause you to have heavier periods. So prostaglandins, which are like a piece of the immune system that throw off inflammation, if these are high, they act on the uterine lining tissue and they cause heavier cycles.
Interesting.
Yeah, totally. So whether that's inflammation rooted in your liver, in your gut, autoimmune conditions, all these things will cause heavier periods. So you need to address the whole picture to address the flow.
All right.
Right? Are you like, oh, is this me?
I got a lot of these things.
I got a lot of these things.
Check and check and check and check.
Yeah. And then the last thing would be actual like clotting disorders. So these would be things that you get assessed and worked up. So things like von Willebrand's disease or platelet dysfunction that can lead to bleeding issues. So that's a wrap on all the female specific things that can be going on.
Okay.
Yeah.
So since I have a lot of these things and we did learn my iron number, how do we treat me? How do we treat the world?
Yeah.
Treatments for iron.
So going back to like what we just reviewed, the reason why I started off with like, what are the causes instead of jumping into like treatment is that though we can take iron in different delivery methods, the biggest thing that you could do for yourself is to pinpoint the root cause. Why?
Right.
Why is this happening? And treat there. Though we can bring your levels up in the meantime while we're addressing that root cause until that's corrected, you will be spinning your wheels to get your iron up, whether it's trying to orally supplement and slowly like work that uphill battle of getting your levels up because you're chronically hemorrhaging or losing blood for some sort of reason, and then you're adding iron in. So it's kind of like a slow burn. So if you don't correct the leak whatever's causing that leak, it's going to be really hard to get your levels up. We can infuse, but unless you take care of that, then it's going to be tricky. So always work with someone who is not just going to say, oh, just take this, like iron, it's oral iron, and go on your way, right? You want to be like, well, why is this happening? And can we address why I have low iron? Because then you're not going to be fighting this. If you can fix that, then you're not going to have a problem in the future, right?
Makes sense.
Then what do we do in the meantime? So in the interim of figuring that out. So we have two options, either oral iron supplementation, which there's two varieties actually, just like in nature, we have two varieties. So we have the heme sources and then non-heme sources. So we have heme iron that we can take, and it's same like with meat, it absorbs a lot more readily than the non-heme iron sources of supplement that are out there. And how we actually take these is quite important. So has anyone ever, I bet someone has told you, but taught you how to take your iron? Like what to do, what not to do, when to take it?
Well, I originally took iron and then it gave me a stomach ache. So then I take it sometimes at night, right before I go to bed.
Okay. And then has anyone ever commented on like things that you should avoid taking it with?
Yeah. So I have thyroid issues. So I take my Synthroid in the morning and I take my iron at night because I can't take them together because iron will do bad things to my Synthroid.
What about whether or not taking iron with food or without food?
I think you're supposed to take it with food.
No. I'm glad you said that.
Me too.
Okay. Yeah. So especially with the non-heme iron, this becomes a bit more fickle. So non-heme iron is more likely to bind things like zinc and magnesium and calcium. So if you were to like take your iron with a big old cup of milk,
A big old one,
it's not going to go well because of the electrochemical charge of these minerals. They'll bind each other. So they're like attracted to each other. So if they bind each other, then absorption is exponentially even more difficult. So you don't want to be taking your iron with food just to like protect yourself from that. And then even things like tannins. So if you're a tea drinker, there's a lot of tannins within tea, and the iron will bind to the tannins and you won't be able to absorb. So that's why we actually suggest it's like easier as a doctor say, like take it before bed, because the hope is that you're not eating close to bedtime. But we still have to say like before bed, away from food, and then that way we know you're not binding it with anything, but also if there is a little bit of like stomach upset or something, often that will happen when you've already fallen asleep and you just don't really notice it. Not to say that you should have to take an iron that makes you feel sick, because there's a lot of options out there that will not make you feel that way, but it's kind of a good strategy. And then it's actually better, especially for non-heme, to take it every other day. So there's some really good research that came out quite a few years ago now where it showed that if you take iron every day, your body kind of shuts down absorption because it perceives it to be iron overload, because you can overdo iron. So there's mechanisms that are in check in your gut that will just say, nope, too much. There's too much here, just because it thinks too much is coming in, not that there is too much. So every other day, you'll actually start to absorb your iron better.
It just shows like I'm like a decently intelligent human being. I've been on iron forever. It's like these things get lost in the mix of it all. Like I should know that, but obviously I don't.
Doesn't ring a bell.
No bells are ringing.
No bells
so it's like
are
this
ringing.
stuff is so, especially if you're dealing with multiple things and you hear it once and then you just take it and then life happens. And so, like it's a lot out there to do this properly.
There's a lot of information. And then like the other like added thing you could do is take it with like a vitamin C tab. Vitamin C is known to help with reducing the irritation as well as improving absorption of your iron. So a 500 milligram tab of vitamin C with your iron can be quite helpful.
I think you have told me that before, but I didn't remember it till now.
Yeah, this is a good reminder.
So yeah, I mean, also like if you're listening to this and you're having some of these aha moments like me, kindness to self, it's a lot.
Yeah, no, there's so many little details that even like, I think that's why we're doing this too, is that for me, even, naturopathic doctors spend way more time with their patients, and still there's so much that I cannot cover in the appointment times that I should and need to, that people need to know, but you can't do it all. So sometimes little things get missed. That's where these kind of platforms become more important, because you can speak about it in greater detail and get that out. You know what I mean?
Or even when you see, like, I see a naturopathic doctor and you'll be like, how did it go? Like, tell me what they said. And I'll be like, they said some stuff.
Yeah, that's a lot of information.
It's really hard because
Yeah.
it's different than just like the few kind of like quick things you would get from your MD, which can be also really good too. I have a good MD, but it's just different, right? So yeah,
it's very different. So that's like oral supplementation. And then we do now, for a long time, we've always had the option for iron infusions, but as far as like in Canada and BC, particularly as far as the regular medical system goes, where it's publicly funded, that we all should have access to this. In order to get a referral for an iron infusion, it's not based off you being iron deficient. And if you go back to the first episode on what is iron deficiency, where we noted the difference between iron deficiency and then anemia, you will only get referred for an iron transfusion, which is IV iron, if you're anemic. So your hemoglobin has to be impacted, starting to go down for GPs to get approved for you to be able to go get a transfusion in the hospital. And even so, if you do meet that criteria, which means that you're like just feeling the worst you've ever felt, probably, it'll take about 9 months now, if not longer, to get in for that transfusion, because that's how long the waits are. So,
and those are like, I mean, I don't believe an MD, even if they wanted to give you a transfusion, they can't.
What do you mean?
Like they can't just refer if you're over that certain benchmark. There's just no, like, MSP just won't.
No,
like, it's just
you won't. Like if you're, like I said, iron deficient, which is based off ferritin levels, generally speaking, even if you're 15, which is the cutoff, they'll still be like, sorry, you're fine. Like this, I just can't. It's not. It's all based off of a number, a very specific number, and a ferritin of 15 is not what it's based off of. It's hemoglobin. So that's kind of the regular medical system. And then there are private clinics within that actually medical doctors run. One is called Mainline, which actually in the last year or two got bought out by TELUS Health, which is interesting. So I would refer people there before I personally did iron infusions myself. So that's still run by nurse practitioners and medical doctors, but it's a private clinic in which you would pay out of pocket versus MSP's not going to cover it, even though it's run by medical doctors and nurses. And then naturopathic doctors. So now in the last 2 years, we've been able to administer IV iron, which is amazing. And though the word isn't totally out yet, more and more people are coming to naturopathic doctors to get this because they're realizing the wait times in the regular system. So if you do have naturopathic benefit, generally speaking, majority of that cost, which there is a cost, unfortunately, like I am a pay for, what do you call it?
Yeah, like it's a private business.
It's a private, it's its own healthcare system. Unless you have benefits, you have to pay out of pocket to see me, which is probably the worst part of my job. Yeah, truly. But if you have benefits, generally, so the prescription, the iron itself is generally covered because it's considered a drug. So that's what we put into the bag. And then our sitting fee would be considered a naturopathic fee. So you have naturopathic funding through your extended, then that often will get 80 to 100% covered. So it becomes quite economic, but again, unfortunately, only for those that have the coverage. Otherwise, it really adds up. The drug itself is $550. The sitting fee is $250. So you can see, like, this is the bad part of my job because it's something that not everybody has access to. It's
like therapy in a lot of ways. Unless you have benefits, it's just like,
it's too bad.
It's really unfortunate. Yeah. So absolutely.
Yeah.
But it's good to know that that's an option, especially if people aren't aware that, like, the NDs of the world can do that. So maybe one day I'll find myself sitting in a chair with an iron infusion in my
hopefully
arm. Maybe. Stay tuned, everyone. Okay. Anything else about iron, treatment of iron? Anything iron?
No, I think that kind of just like wraps it all. It's like a good synopsis of everything.
Yeah. Amazing. Yeah. Okay. Well, if you have anything you want to, like, say about this, comments, questions, you had any, like, aha moments like I did, and like I had many of them over the last 3 episodes, like, write a comment, say something below. We will answer them. She will answer those with iron because I'm clearly learning with you. Yeah. And if there's anything else that you want us to talk about in future episodes, tell us that. We're open to talking about all and anything. mostly. So thank you so much for being here.
Yeah.
Bye.
See you next time.
Please contact your own healthcare providers before you make any changes to your health and wellness protocols related to your body and mind.